Infant and young child feeding is a framework that looks at breastfeeding and complementary feeding support for children who are less than 2 years, but the framework overarches multi-sector collaboration and the contribution to the well-being of pregnant lactating women and children less than 2 years through their 1,000 days of life.
IYCF practices are vital for the well-being of our refugees, especially the mothers who are breastfeeding and those who take care of the young ones.
During inception, there was a launch, and after that, there were in-house trainings of all sectors and units, and then implementation took place at a camp level. We have thematic meetings. These are all for related themes: wash, health, nutrition talk together, environment, protection, and other groups also talk to each other. That's a forum to see where sector-friendly themes can be developed further.
Initially, the wash sector would just see themselves as just there to provide water supply, sanitation and hygiene, but not following up to see the actual impact. So with this framework, or coming together, having an intersector group, which wasn't there initially, it has helped the wash partners, the wash sector, to actually see the impact of the work we do.
Before the launch of the infant and young child feeding, we had missed out opportunities in the vaccinations. But with this particular program, then the baby-friendly spaces offers the opportunity where we have all children being given that priority to go through the immunization processes.
It's important because the entire well-being of the child and the mother is affected by so many other aspects beyond things like food. Shelter is a very important aspect. Access to clean water is a very important aspect of the well-being of the refugee. And all the other sectors like child protection have a role to play. Education, health, all these are integrated when we're taking care of the child.
Integration of infant and young child feeding for vulnerable populations, pregnant lactating women and children under 2 years, saves lives.
So in terms of rolling out of the framework, Cox's Bazar is a bit complex because we have quite a number of sectors and we are still in the emergency period. How the framework helps us in Cox's Bazar basically is to look at how we involve all the other partners, for example, camp management, in addressing the issues.
Yes, we have in our health post, also we have a dedicated trained person on IUSCF.
Last year we have trained traditional birth attendants from health sector. So we trained them on IUSF component to ensure actually the early initiation of breastfeeding.
Based on the 2017 rollout, at least we have some positive practices that are going on. For example, in most of the food distribution centers, we have at least breastfeeding corners, and also mothers are prioritized to access food. In at least most of the health facilities as well as nutrition centers, we have the breastfeeding corners, which was one key recommendation from the IYCF framework when it was developed.
হাসপাতাল জ্বালিয়ে হেরিমা আলাদা রুম আছে ফোন ধরে হেরিমা দুধ দিবারে এড়াইলিও আলাদা রুম আছে তারা হাসে আরা ন জানি তারা তো ফুসাল ফোন হাদের ফোন ধরে দুধ খাবার জন্য তাই আলাদা রুম আছে হিয়ানো যায় আর দুধ খাবার হিয়ানোর অসুবিধা না
IUCF সাধারণত ফুড সিকিউরিটি, হেলথ, ওয়াশ এই ধরনের কিছু প্রোগ্রামের সাথে ইন্টিগ্রেটেড আছে। ফুড সিকিউরিটির সাথে যখন ইন্টিগ্রেটেড হওয়ার কারণে আমাদের কাউন্সিলিংয়ের জন্য আসা মা এবং দুগ্ধদান মায়ের সংখ্যা অনেক বেড়ে গেছে। ওয়াশের সাথে ইন্টিগ্রেট হওয়ার কারণে তাদের হচ্ছে হাইজিন সম্পর্কে আমরা অ্যাওয়ার করতে পারতেছি হিউজ অ্যামাউন্টে।
So we are hoping that with the involvement of other sectors, we should be in a position to achieve the role and the goal of the framework, to ensure that at least all the issues that are key in terms of developing synergies and ensuring malnutrition is addressed across all the sectors.
IYCF is very important. What I see as a key part is that it brings all the sectors together, and it enables the sectors to see their contribution, so that someone in WASH does not just look at WASH as just providing water and sanitation, but goes down to see the real impact of the service to the household and to the child, whom if we do not address their needs at that level, when they're still very young, it would definitely affect their well-being.